Now let's talk about acne vulgaris. It is an interesting topic, and I guess most of you guys must have gone through a phase where you are having acne and all. And I have taken my points in this module from Mandapa Manipal Manual of Medicine, and here I'll be discussing about how to write this acne vulgaris for a 4 marker. Mostly it will be asked as a 4 marker only in our university examination. So let's start. What is this acne? The definition: it is a chronic skin condition. It is a chronic skin condition that is involving the blockage and or inflammation of the pilosebaceous unit. Blockage and inflammation of the pilosebaceous unit is called acne vulgaris. What is this pilosebaceous unit? It is the hair follicles along with their accompanying sebaceous gland. That is pilosebaceous unit. Blockage and inflammation of this pilosebaceous unit is called acne vulgaris, and it is a chronic skin condition. And this acne is seen in most teenagers, we know that, and peak severity is in late teenage years. This point is not that important because everybody knows that. Chronic skin condition involving skin blockage and inflammation of the pilosebaceous unit. That is a definition. Now let's see the etiopathogenesis. It occurs through the interplay of 4 major factors. What are those major factors? Let's discuss one by one. One is increased sebum production. There are 4 major factors in etiopathogenesis. One is increased sebum production. Two words about increased sebum production. With the onset of puberty, the sebaceous glands will be enlarging and the sebum production will increase. And the androgen is responsible for that. In our puberty, our sebaceous glands will enlarge and it will start producing more and more sebum. And our androgen is responsible for that. That is the first major factor, increasing sebum production. Second one is follicular plugin with sebum and keratinocytes. There will be blockage of this pilosebaceous duct due to the retention of keratinous material and sebum, and it will lead to the formation of small cyst called comedones. This word comedone is very important. So the first one is increased sebum production. How the sebum is produced more, that we have discussed. In the puberty, our sebaceous glands will enlarge and it will produce more and more sebum, and the androgen hormone is responsible for that. The second point is follicular plugin with sebum and keratinocyte. So this plugin will lead to blockage of the pilosebaceous duct and there will be retention of the keratinous material and sebum. Then there will be formation of small cyst because it is retained inside. So small cyst will be formed and these small cysts are called comedones. The third point is colonization and activity of bacteria. In this small cyst or in this retained material, there will be activity of the Propionibacterium acne within these comedone. And these bacteria will be releasing free fatty acids from the sebum, and this will cause an inflammation within the cyst and it will finally cause the rupture of the cyst. So colonization and activity of bacteria. Which bacteria? Propionibacterium acne. That is the bacteria here. Inside this comedone, they will be releasing the fatty acid from the sebum and they will cause inflammation and finally the cyst will rupture. That is the last point, the rupture of cyst. After the rupture of cyst, the oily keratinous debris will be coming out through the cyst and this will cause the inflammatory foreign body reaction in our skin. So this is the etiopathogenesis of acne vulgaris. I guess it's clear. There are 4 major factors: increased sebum production, and then follicular plugging of the sebum and keratinocytes, and then colonization and activity of the Propionibacterium acne inside this comedone, and this rupture of the cyst, releasing the oily and keratinous debris and will cause foreign body reaction in our skin. That's it. Now let's see what are the clinical features. Hallmark clinical feature here is comedone. And there are 2 types of comedones which are present. Some are closed and some are open. These closed are called whiteheads and the open ones are called blackheads. Thus we know. Comedones, closed ones are whiteheads and open ones are blackheads. And these closed comedones appear as 1 to 2 mm white papules. 1 to 2 mm white papule. Inflammatory papules, nodules, cysts occur and healing may lead to scarring. And the lesions are maximally seen on our faces. It can be seen on hands, shoulders, etc. but it is maximally seen on our faces. So these are the things that is about clinical features. Hallmark, comedone, don't forget. Coming to the management part. What is the goal? What is the aim of our management? We have to eliminate the comedones. How can we eliminate these comedones? Normalization of the follicular keratinization we can do. Decreasing sebum production we can do. Decreasing the population of Propionibacterium acne we can do. Or we can do decrease the inflammation. So One is normalization of the follicular keratinization, so there won't be any blockage. We can decrease the sebum production, so there won't be excess production. Decrease the population of propionibacteria, so bacteria won't be there, and we can decrease the inflammation. So these are the things that we can do to eliminate these comedones. Now let's see, there are two types of methods, local measures and systemic measures. So first let's discuss about local measures. As local measures, what all we can do? The local measures are good for the mild to moderate cases. It is not good for severe cases. So local measures are applied for the mild to moderate cases of acne vulgaris. What are those? Regular washing with soap and water. This is the basic and the most efficient method to control acne vulgaris. Regular washing with soap and water, and then topical keratolytic agents. What are those keratolytic agents? Retinoic acid, benzoyl peroxide, salicylic acid. There are so many creams available. Topical keratolytic agents. The contents are retinoic acid, benzoyl peroxide, salicylic acid. And then topical antibacterial agents. What are they? Okay, this spelling mistake is there. It is not Adelaide, it is azelaic acid and topical erythromycin or clindamycin creams. Azelaic acid. Spelling is one second. AZELAIC. LAIC. Azelaic acid. Azelaic acid, topical erythromycin or clindamycin. Then the other methods are incision and drainage of the cyst. We can do the incision and drainage of the cyst, and intralesional injection of triamcinolone. The spelling mistake is again there. Triamcinolone acetonide reduces the inflammation and hastens the resolution of cyst. Intralesion, in the comedones we can inject the triamcinolone acetonide. It will reduce the inflammation and it will hasten the resolution of the cyst. And dermabrasion and excision of scar we can do to improve the skin appearance. So once again I am repeating what are the local measures. Regular washing with soap and water. Topical keratolytic agents we can use. What are those topical keratolytic agents? Retinoic acid or benzoyl peroxidase, salicylic acid, etc. Topical antibacterial, azelaic acid, topical erythromycin or clindamycin. Then we can do the incision and drainage of this cyst, and then intralesional injection of triamcinolone we can do, and dermabrasion and excision of the scar we can do to improve the skin appearance. These are the local measures. Now let's see what are the systemic measures. These systemic measures we are using in severe acne. The first one is antibiotics. We are giving tetracycline and doxycycline because these two drugs are having effect on the propionibacterium acne and it will reduce the inflammation also. So tetracycline 250 to 500, it is 500 milligram, 250 to 500 milligram BID, or doxycycline 100 milligram BID. And also systemic retinoids we can give. There we gave topical keratolytic and topical antibacterial. Here we are giving antibiotics and systemic retinoids. Systemic retinoids isotretinoin. That is a drug which we are giving, and it is used in severe acne which is unresponsive to any other therapy. Then only we will be giving systemic retinoid, because these systemic retinoids have very bad side effect. What are they? Like teratogenicity is also there as side effect for the systemic retinoid. So systemic retinoid isotretinoin, that is a drug, and also estrogen, the OC pills, oral contraceptive pills also improve acne in women. So these are the systemic measures for acne, severe acne. Antibiotics, tetracycline, doxycycline. Systemic retinoids, isotretinoin. It is used in severe acne. If nothing is working out, you can use it. And estrogen, oral contraceptive pill, is also improve acne in women. So these are the things you have to write for a 4-marker when acne vulgaris is asked. The main important thing is definition. What is acne vulgaris? You have to write. And then etiopathogenesis is very important. These 4 points you should write. You can make it as a good flow chart and all. I can explain it nicely. Clinical features, comedone, that is a hallmark, and whiteheads, blackheads, 1 to 2 mm in white papules, inflammation, etc. Scarring you can write. Management, we have to eliminate the comedone. What are the way to eliminate? We know by the pathology. What are the pathology happening to reduce that? The ways you have to do. Local measures, washing, soap and water, keratolytic agents, retinoic acid, benzoyl peroxide, salicylic acid, antibacterial, azelaic acid, topical erythromycin or clindamycin. Incision and drainage, intralesional injection of triamcinolone, acetonide, dermabrasion and excision of scars, done, etc. Systemic measures include severe acne, antibiotics, tetracycline, doxycycline, systemic retinoids, isotretinoin, estrogen. These will also improve acne in women. So, thank you all. Have a